Good afternoon, everybody. Thank you for coming along today. I want to begin with a further update on the position with coronavirus in Scotland. First of all, I can confirm that as of 9 o'clock today, there have been 894 positive cases confirmed, which is an increase of 175 from yesterday. And as I always do, let me be clear that these numbers will be an underestimate. It's also with sadness that I can report a further 3 deaths of patients who had tested positive for coronavirus, taking the total number of deaths in Scotland now to 25. And I, of course, want to extend my condolences to all of those who have lost loved ones. And again, thank our NHS staff who are continuing to care for people suffering from the virus. Their efforts are enormously appreciated. I also want to thank the many other people who are helping to keep essential services going at this time of crisis. I've got a few things I want to update you on today before I hand over to the Cabinet Secretary and the Chief Medical Officer and take your questions. The first of those is that the coronavirus bill passed by the UK Parliament yesterday gained royal assent yesterday. That means the Scottish Government now has the power to make regulations to enforce the social distancing measures that we announced on Monday. We're now preparing regulations to give police in Scotland enforcement powers. Colleagues in the UK Government are working to do the same, and we expect these regulations to be enforced as soon as possible, perhaps as early as today. The regulations give us power to enforce rules which most people are now following anyway, and I want to thank people across the country for their compliance with the advice. These enforcement powers, I hope, do not have to be used, but they are there to make sure that we can ensure the right things are done to help us delay the spread of the virus. So where necessary, the regulations will give powers to require the closure of listed businesses and premises and will help to ensure that social distancing is enforced by those businesses and premises which are able to continue operating. The regulations will also provide enforcement powers for the police and, where appropriate, for people designated by local authorities. They will help to enforce the rule that should be no public gatherings of more than 2 people, except where these are people from the same household or in other limited circumstances, such as responding to an emergency or work-related purposes that is genuinely essential. They will also enforce the restrictions on people staying at home. It will now be the rule that you should only be outside for a reasonable purpose, buying food or essential household or medical supplies, travelling to or carrying out essential work, exercising once a day, or providing care or assistance to others. And those found not to be acting in line with the regulations can be directed to return home or made to return home. They can also be subject to prohibition notices. And if people don't follow prohibition notices or instructions to return home, they could be liable to an on-the-spot fine and ultimately, if necessary, prosecuted. Now, as the Chief Constable set out earlier this week, and I echo these comments, we expect the vast majority of people to do the right thing without any requirement for enforcement. I want to remind people why they are being asked to follow these rules. It is because by doing all these things, we help to slow the spread of the virus, reduce its impact on our NHS and ensure that the health service can provide treatment to those who need it. And ultimately, this is about saving lives. So I know that many people want to do the right thing, and I encourage people to continue to do that. This will get harder with every day that passes, to stay at home and to follow all the advice, but it remains essential that we all do so. The police will continue to take a soft approach to enforcement, but they will, as of these regulations coming into force, have the power to act if that is deemed necessary. And I acutely recognise how unusual and out of character these regulations are. They will have important safeguards. They must be reviewed at least once every 21 days, and we will act to remove these restrictions completely as soon as it is safe to do so. The legislation itself will last for a maximum of 6 months. These regulations would have been unimaginable just a few weeks ago, but the measures, I repeat, are essential in order to tackle this virus and the impact that it will have on all of us. One question we've continually been asked, and this is the next issue I want to update on, is about equipment for health and care staff. And I want today to take the opportunity to emphasise to NHS workers and, of course, to those working in the wider care sector that we know how important this is. This is an issue that we attach the highest priority to. And we're announcing today that we have brought an extra £1.5 million face masks back into use from the NHS Scotland central stockpile. These protective masks were stockpiled because they were past their expiry date, but they have now undergone extensive testing, which has shown them to be fit for use. And I'll ask the Cabinet Secretary to say a word or two more about PPE in a moment. We also continue to do everything necessary to protect businesses and communities from the economic impact of these essential public health measures. I welcome the fact that the Chancellor will provide details of support for self-employed people later on today. This is something the Scottish Government has consistently called for, and if there is a role for the Scottish Government following these announcements, we will do whatever is required to ensure that self-employed people in Scotland get the help that they need. But we appreciate that people may be beginning to struggle now, and that some people face the prospect of several weeks' wait for funding. Aileen Campbell last week announced £350 million of funding, which included extra support for the third sector and for councils to help people cope with the economic and social impact of this crisis. As part of that, we more than doubled the Scottish Welfare Fund, which is administered by local councils, and that makes community grants and crisis grants available to those who are in immediate need. These funds now have more flexibility, and people should know that they are there for anyone who is facing real hardship. Other support is also available. While I know there are long waits, I would encourage people to ensure that they apply for statutory sick pay or for universal credit. Speak to your local council about your council tax to find out if you're eligible for a council tax reduction. The Scottish Government has given councils more money to support that. Speak to your energy provider if you're finding it hard to pay your energy bills or having issues with a prepayment meter. They have schemes in place to help with that. And you should speak to your mortgage provider or landlord about your rent or mortgage. We've been very clear that 6-month mortgage holidays should be available and that nobody, absolutely nobody, should be facing eviction as a result of this crisis. My message today is that help is available. So if you're suffering hardship and you haven't yet explored these options, please reach out. The earlier you do that, the earlier you can access assistance. And that helps to summarise some of the key developments in the last 24 hours. However, as you will have gathered, our key message remains the same. The Scottish Government, working with the UK Government, is supporting our NHS to meet the challenge that it currently faces and the even tougher challenge that we anticipate lies ahead. But we're also working flat out to ensure that communities and businesses and individuals across the country get support as well. But this is, indeed it has to be, a collective effort. The power to stop this epidemic rests with each and every one of us as individuals. By sticking to the lockdown, by staying at home except when it is essential not to, and by keeping more than 2 metres apart from each other, all of us can help to slow down the spread of cases, and ultimately that helps us to reduce the number of people who will die from this virus. And if we help each other as we do that, finding existing and indeed new ways to support each other, even as we are physically separated, we can all help each other get through this. So once again, I want to thank everybody across Scotland who is taking these steps. And please know that no matter how difficult this is, and it will get more difficult as the days pass, in complying with these measures, each and every one of you is helping to save lives. So thank you for that. I'll hand now to the Cabinet Secretary who will say a few words about protective personal equipment, and then I'll hand over to the Chief Medical Officer.
Thank you, First Minister. Can I start with the FFP3 respiratory masks that we have released for use today from the central stockpile that First Minister mentioned? Those masks had expiry dates of June and August 2019, which is why we had not released them until now. We had them independently tested in order to ensure that they remained safe and valid. That testing has been supplemented by the view of the Health and Safety Executive and our own HPS and our Chief Medical Officer, and also has the support of Dr. Miles Mack, who is the Chair of the Academy of Medical Royal Colleges and Faculties in Scotland, all of whom assuring that these masks are safe to use, and they will be now issued across those parts of our health service where there are the appropriate mask as protection for staff for them to use. In addition, as everyone knows, we are paying very close and detailed daily attention to the overall stock of PPE for our health and social care staff. We are now have now taken over the ordering, supply and distribution of PPE to social care and care at home staff, and are looking daily at not only the ordering but also what is in the pipeline. As of today, we have no shortages in those areas. We are increasing the distribution routes and networks in order to ensure that the supplies that people need get to where they are needed across the country, including in our remote and rural areas, as quickly as possible. Because as FM and indeed the Chief Medical Officer have said, and I too repeatedly, the safety of our health and social care staff is of absolute critical importance. And so we are taking every step we can to make sure that they have the equipment they need as quickly as they need it, and that we have orders in the pipeline to ensure that stocks are consistently replenished.
Okay, thank you, Cabinet Secretary. Cyril.
Thank you, First Minister. Once again, we've seen the number of confirmed cases in Scotland rise, and very sadly, the number of deaths again has risen. As I've said before, this, of course, is a very significant underestimate of the number of cases in Scotland, and we're probably looking at of the order of perhaps 40 to 50,000 people in Scotland who are now infected with coronavirus. Many of them don't yet know that they are infected, nor indeed do they realise that they are potentially going to infect those around them. It's been very encouraging to see the empty streets and the empty shops and the empty transport in Scotland. This is going to be a long haul, and I just encourage people to, as the weekend comes, a weekend perhaps unlike any other you've ever experienced. The children are already asking if they can go back to school because they miss their friends and all the fun that school can bring, as well as the hard work. But as we approach the weekend, to not relax those rules, to not be tempted to see other families from other households, that combining yourself to your own household, to not mixing with other people who then are mixing with others, is so key and so important. And I'd thank those who have been able to do this so far, but really just encourage, the virus is out there, you do not know who has it, to stay away from as many people as possible, stay with your family, stay with your household. Please do get out and exercise just once a day. That's very, very important for all of us too.
Okay, thank you. Can I open to any questions? Mark.
A couple of different strands of questions. First on the justice and then the health. How much is the on-the-spot fine? What's the maximum fine and period of imprisonment if you are prosecuted? And will there be any additional penalties for business if, for example, your boss orders you into a small room with a bunch of people? And on the health side, was the Army Volunteers in England? What's the Scottish equivalent of that, the NHS Volunteers? Can you tell me more about field hospitals? What premises are earmarked, is it like the SEC, something like that? And the numbers that you mentioned of 40, 50,000, that's nowhere near the 50% that we were talking a few weeks ago for herd immunity. So are we now at risk of a second wave after this lockdown ends?
Okay, I'll pass over to Catherine on the health questions. On the questions about penalties, where right now you'll understand how quickly we're doing this work. We're just finalising all of the detail around penalties and things like the fine level and potential imprisonment, and that will be published later today once we've finalised that. We're trying to have as consistent a position across the whole of the UK, although these regulations are Scottish Government regulations, and we'll publish that as soon as possible today. I would take the opportunity, though, to stress that these enforcement measures, I would hope, never have to be used. They're there as a last resort. They're there to underline the seriousness of what we're asking people to do and the importance of very high compliance. But my hope is that people will comply for the right reasons, the health protection reasons, and that the police will not have to use these enforcement measures. But the detail you're asking for will be covered later on. On the question about the volunteers, there are numerous routes, and again, we can set this out for people, that people can and are offering their services to the NHS or to community efforts, and in non-NHS senses, these will be coordinated by local resilience partnerships. What we're looking at right now is bringing together a central point for people, whatever it is they want to do, whatever their skills are, that they can come to and register their interest. And again, there'll be more information provided on that shortly. On the issues about herd immunity and spread and second wave, I'll hand over to the Chief Medical Officer.
Thank you. We know from modelling that these suppression measures need to be in place for a long time. We've said that repeatedly. We do also know that there will be a spike of cases once we have suppressed and released those measures. Our new COVID-19 Scientific Advisory Group for Scotland is meeting for the first time today. And amongst a list of asks I have of them is to watch what's happening in other countries as those measures are being lifted. So, for example, China has lifted its measures. It took 5 days before they were starting to report new cases again. So we want to follow what's happening across the world so that we can, through that scientific advisory group, provide the bespoke, scientifically based evidence as to what we should be doing in Scotland. You mentioned, I think, field hospitals. I think those words are used perhaps more loosely than a traditional field hospital that we have all the time. We have our Scottish 205 field hospital always available, and training processes for supporting the armed forces were there to be a reason to be deployed. What we are talking about really is increasing NHS hospital capacity. So we have been in early discussion with our colleagues in the armed forces. That's a UK armed forces would have an offer across the UK, and we are looking as to what we would want and need in Scotland, and also where those sites would be. So we want to have our NHS capacity as maximised as possible, and one possibility is therefore having temporary hospitals to increase that capacity.
Lisa.
My question probably follows on a little bit from that. I was just wanting to discuss intensive care. Are we on this kind of same trajectory as other parts of the UK in terms of kind of the capacity of our intensive care beds, because it's been rising steeply over the last few days? Where are we in terms of getting that additional capacity? The Cabinet Secretary talked about quadrupling it to 700. So how many do we have ready now? And again, sort of, I guess, following on about extra capacity, are you now in a position to say that you wouldn't rule out using Edinburgh's empty sick kids hospital as an opportunity to create more beds?
Can I just say a couple of words on that, and then I'm going to hand over to the Chief Medical Officer on the issue of where Scotland is in relation to other parts of the UK, and then to the Cabinet Secretary about NHS capacity. I gave a number yesterday for those that we know as of the night before that were in intensive care. That number today is 57 in intensive care. We have spare capacity in intensive care right now, but that's been monitored closely, and the work to increase intensive care capacity is ongoing and will continue to be ongoing. Catherine, do you want to maybe address the point of where we are in relation to other parts of the UK, and then Jean can say a bit more about the steps we're taking to maximise capacity, not just in intensive care, but across the NHS?
We still remain behind, particularly London, but also behind other parts of England as to the number of cases and that pressure on the NHS, both acute beds and also intensive care beds. We perhaps have put these suppression measures in earlier on that upslope of the curve. And what we hope is, therefore, that rapid acceleration that we have talked about is perhaps not as rapid as has been seen in other parts of the country. It's not that I'm saying it's not going to be rapid, and these numbers of cases already you're seeing day after day increasing, but perhaps not as rapid, particularly when we've got good compliance with these suppression measures.
So you remember that what we said initially in terms of intensive care beds was that we aim to double the number that we currently have and take that to 380. We are well on track to doing that, but we need to keep a number of those in terms of our calculations for non-COVID patients, because of course emergency and urgent care and maternity care continues in our NHS. So we're on track for that doubling, but we have set ourselves the aim of quadrupling the number, so we would double that again. and that work is underway to look at all the ways by which we might do that, alongside our work on securing additional ventilators and the supply and medical equipment that would be needed to stock up that quadrupling of intensive care beds. On the other measure, which was increasing the capacity inside our NHS, at the moment in terms of beds, not intensive care beds, but beds, we said we would release 3,000 from the existing bed capacity in order to have that set aside for COVID patients. And we have almost secured that. We're a couple of hundred short, but we'll get to that 3,000 very quickly. That has come largely from the other steps we've taken about pausing elective care and so on, which also in and of itself frees up intensive care demand. And on your point about the new sick kids hospital in Edinburgh, you'll recall that the reason why I stopped the move into that hospital was primarily around ventilation, but encapsulated other areas, all of which added up to patient safety. The work is underway to resolve all of those patient safety issues, but right at this moment, the hospital itself is not safe for patients. So we would not look at using that facility in this circumstance. And that is why we are also then, as the Chief Medical Officer has said, investigating the possibility of whether or not we might need the field hospital approach in order to give us additional capacity over and above those 3,000 beds for patients who would not be COVID patients.
Can I just round off in this, I suppose, with a message directed to people at home watching this, because there are two strands of work ongoing here, and the second strand is one that we can't do alone. It's why we're asking everybody to stay at home. So we're working hard to increase the capacity of the NHS, intensive care capacity and general hospital capacity, to get that maximised as much as possible. But the other strand is to reduce the demand that will be placed on our NHS, and that is why it's so important for people to follow the advice, because the more people do, then the more we'll slow down the spread and reduce that peak impact. So the ability of the NHS to cope, it comes when we get those two strands in equilibrium. So we are working hard on the first, and we need everybody to help us with the second, so that we maximise the chances of our NHS coping. And that comes back to the central point here. Government is working flat out on this. Literally, we've got people working round the clock doing all of this. But our success here is literally down to all of us, because every single person who is doing what the health advice tells them to do right now is helping us to make sure that our National Health Service will not be overwhelmed. And if we can achieve that, then everybody, and there will be people who need treatment as a result of coronavirus for weeks to come, everybody has the best chance of getting the treatment they need. So we're literally we all have a part to play in this. Any final? Yes, up the back.
With regards to field hospitals, what sort of capacity are you looking at as the number of beds that you're looking to sort of have available? And with regards to 10,000 Dyson ventilators, are any of those earmarked for Scotland at all?
Okay, on the first point, that's one of the things that is under consideration. So we will, if we decide to have one of those, what we are colloquially calling a field hospital, then we will decide on the capacity and the size of that depending on our judgments of what capacity we need. And obviously, ideally, you have something that can be scaled depending on what you need it. There is obviously, when you have something like that, the need not just to have the physical capacity, but to have the staff who are able to care for patients who would be looked after in there. On the Dyson, there's lots of innovation and there's lots of great offers coming from manufacturers just now, which I encourage as much of as possible. We have in the Scottish Government, chaired by the Trade Minister Ivan McKee, a group that is looking to see how we maximise the manufacturing capability here in Scotland. But I want to stress that if any of these sort of initiatives we're hearing about right now, and I include the Dyson one in that, if they come to fruition, they are over and above what we are planning for. So the numbers you will hear us talking about in terms of trying to increase ventilator capacity, these are numbers based on orders we have firmly placed right now. So anything like the Dyson initiative would, if it comes to fruition, would be over and above that. Yes?
Okay, I've just seen a tweet from one of the MSPs who's going for a pregnancy scan. What would be your advice to people who are thinking about starting or growing a family during this crisis? Because it could last for a very long time, particularly older mothers, may be worried about if they wait too long. I'm also conscious there's a lot of people in the house with not a lot to do right now, so potentially we could see.
You often hand over to the obstetrician in the room.
What would be your advice for people what's that family?
Chief Medical Officer.
As the obstetrician in the room, this has occurred to me that in fact we do need to be advising people. You're right about people having time on their hands, and the labour ward is always much busier 9 months after Valentine's Day. So we have that to consider. The serious point is almost all of maternity services are emergency services. We can't be time limited. We can't pause like elective surgery. So we're encouraging all women who are currently pregnant to come forward, to have their scans, to have their antenatal care. My colleagues in the maternity services across the country have changed very much what they're doing to offer virtual clinics so women don't have to travel, women don't have to be seen face to face, but of course that contact does need to happen. Your wider point, it has been suggested to me that we talk to people about contraception and about really thinking about whether if about 50% of pregnancies are unplanned. So perhaps to think, would this be the right time to have an unplanned pregnancy? This, as you say, will last for some time. We have the emergency services that are maternity services will continue to run though. So we have planned for all of the babies that would have been born to still have exactly the same care that we would have had outside of this pandemic. But people are making difficult choices, and so perhaps we would always encourage people to think on their own health side. Is this the right time for me? Am I in the best of health? Is this a good time for me to start thinking about having a baby?
Falls into the category of the many things I never thought I would be standing here as First Minister advising the public on, or hearing the Chief Medical Officer advise the public on. Yes, any final questions? Yes.
Areas that have particularly higher proportion number of confirmed cases, like Glasgow, is there any specific, localised actions you're going to take for hotspots?
Well, I'll again hand over to Catherine, but that's one of the reasons we've established this group, scientific advisory group here in Scotland, to give us that kind of bespoke, tailored, very granular advice for Scotland. But Catherine, do you want to add anything?
The scientists tell me that it's very important to look for these clusters. What we've asked now is that all of the people who are in intensive care with COVID-19, that virus is genotyped, so that we can see if that virus is the same virus in patient 1 and patient 2, and perhaps also track a source from if one type of virus genotype is found in multiple people. We would take those local data, and absolutely that new scientific advisory group will be looking at tracking virus spread, and also if there would be local measures. It's not going to be local, very small, because that would be very, very difficult, but perhaps much more that if there are certain measures being relaxed in some parts of the country, might that be appropriate for some parts of our country?
Okay, any last questions before we wrap up? In that case, can I thank you all very much, and we'll see you all again tomorrow.